I've known Chris for a long time. He treated my husband way back in the day when he was still working out of essentially the closet of a different CrossFit gym. And I knew that Chris did a lot of soft tissue work, and in the past I've had some work done on my hip, and the only successful treatment I had ever had was soft tissue work. So I decided to go see Chris for that.
Bonnie used to own a CrossFit gym. She's been an athlete all of her life, wants to stay fit, wants to stay healthy. She tore her labrum a bunch of years ago, I think 6 years ago or so. And so now she just really wants to maintain her ability to stay fit, to do her workouts, to hold her child. She has a 2-year-old, and also she wants to sit criss-cross applesauce as well.
Oh, so I have a torn labrum in my hip, and I rolled a 4-wheeler when I was 19. Landed on my hip and landed on my shoulder. We had treated the shoulder because it was a very obvious injury, but we didn't really know that there was a problem going on in the hip until years later. I was a sales rep, I was driving a lot. I had also just started CrossFit, and I was noticing that when I was driving, I was having numbness in my foot, and I was starting to get a lot of pain. And I call it my hip, it feels a lot of times more like the glute area. And for years I went through a lot of different treatment practices. I did PT, I've done a lot of massage, and then I did the soft tissue work, and that was really successful. I no longer had access to go to that practitioner anymore, so I was looking for somebody else who would do something very similar, and that was how I found Chris. I started in the winter. I want to say it was January. I started coming in. Last time I was in there, I told them I feel like I'm about 87% better. They ask, the percentage of improvement every time, and there was definitely in the beginning. I was a little bit frustrated. It felt like it was taking a long time, especially since this is an injury that I've had now for so long. But of course, one of the things you have to remember is, if you're dealing with an injury that's 15 years old, it's gonna take not overnight to get better. And so along with the treatments, Dr. Chris and I have been talking a lot about, well, what are some other things that I can do to help with that? I've been very keyed in on my diet for a long time, but I've now gone even a couple layers deeper to try to help. I've taken out some things that I realized seemed to be causing a lot of inflammation for me, which happened to be nuts and beans. Nuts and beans seem really super innocuous to just about anybody, but for me, they really seem to be causing some extra inflammation.
So when she came in and we did an exam, all of her ranges of motion and function were really good. So I was worried she wasn't going to have a lot of adhesion. She's a little bit of an anomaly that she has really good range, but she did have a lot of adhesion.
As you can see, we're in my home gym here, and I work out a lot. I used to own a CrossFit gym, and I've really realized how much I needed to alter the movements that I'm doing. I can't just jump under a barbell and do squats anymore. Not to say that I'll never be able to do it again, but while I'm trying to let this heal, again, talking with Dr. Chris, like, hey, let's unload your hip for a long time and see how much progress we make. And a lot of these factors combined, along with going in and getting the treatments, first off, I can sit like this right now with little to no pain, which is something that I wasn't able to do for more than 6 months. I started to get to a point where I would look at a flight of stairs and go, oh, I don't want to climb up those stairs. I look very fit. I generally feel very fit, and the fact that I didn't want to walk up a set of stairs, that's not good. I have a 2.5-year-old son who is very energetic, runs around all the time, and for me to not be able to sit on the floor comfortably with him, or to feel like I could just pick him up and take him, go walking somewhere, that wasn't all that great. I also am really into hiking, backpacking, climbing, things like that, and with the hip injury, putting a 30-40 pound pack on my back and going and hiking up a mountain was really tough. And I'm super excited to say that last week, just exactly a week ago today, I went on an overnight backpacking trip and I felt better than ever. I've never felt that good hiking, 16 miles through the woods. So it was awesome.
So the rest of her treatment is just maintaining her here. She comes in every few weeks to make sure that the adhesion stays gone. She's able to work out. She's able to hold her child and walk with him. If I was talking to somebody who had some sort of, probably a more chronic pain injury than an acute pain injury, if you had a more chronic pain injury and gotten a conversation with you and you've said you've tried several other, maybe you've tried acupressure or acupuncture, maybe you've tried, PT programs, maybe you've even had a surgery and you're still having issues, I would absolutely tell you, hey, this, one of the huge benefits of the practice is that you go in and they give you an evaluation and they talk to you. And it's funny to say that I feel like I have about an 87% improvement, because the first time I went in and talked to Chris, he didn't think that I had quite enough adhesion to get more than about a 30 to a 40% improvement. And as we got deeper in and we got more layers in, he realized, okay, no, there is more adhesion there, and it's just been very beneficial for me. Oh my God, I love the Barefoot staff. It's every time you walk in, everyone's smiling, they know you by name. There's always hugs, there's always it's just so pleasurable. And I love that I can bring my 2.5-year-old and not have to worry about people being like, oh, there's a kid running around, because he runs around and he's a little crazy man. But everybody there loves him. I love going. It's definitely a pleasure.